When you think about outbreaks on cruise ships, you think about norovirus, influenza, COVID. You don't think about hantavirus. But in May of 2026, a hantavirus outbreak occurred on a ship that had traveled from Argentina to Antarctica and the Cape Verde Islands. This outbreak was fatal. People died and got a lot of people scratching their heads about how hantavirus ended up on a ship. What I'm going to do in this video is explain and set the context for hantavirus in light of that shipborne outbreak, but also provide some context around how hantavirus outbreaks occur. So, hantaviruses are a grouping of viruses. They're in the Bunya virus family, and they're basically worldwide viruses of rodents, mice. And they don't usually infect humans unless humans are exposed to mice. And this has been something that's been known since the 1930s. There are hantaviruses that circulate in Europe, that circulated in the trenches during the Korean War, that can cause infection when people were exposed to the rodents. And that infection caused kidney damage and sometimes hemorrhagic fever. So it often had the name HFRS, hemorrhagic fever with renal syndrome. Fast forward to the 1990s, and an outbreak of hantavirus occurs in the Four Corners region of the United States. So the Four Corners, New Mexico, Arizona, Colorado, you get it. And in that situation, an outbreak occurred in young individuals, some of whom were Navajo, who had flu-like symptoms, and then their lungs filled with fluid, the way someone with congestive heart failure's lungs fill with fluid, and they couldn't breathe. And people died. That's hantavirus pulmonary syndrome. And that's caused by a distinct hantavirus called the sin nombre or no name virus that occurred in the Four Corners area of the United States. What we know here is that after an incubation period of about 2 weeks, and that incubation period will follow some exposure to rodent excreta. Usually, maybe somebody might be cleaning out a barn, cleaning out a shed, cleaning out an attic. And when they're doing that, some of the rodent excreta gets aerosolized and you inhale it. Maybe 2 weeks or so later, you start to get symptoms of fevers, chills, muscle aches, and pains. And maybe you go see a doctor and you're diagnosed with influenza, but it's not influenza. And you come back later in severe respiratory distress, can't breathe. And that's how they discovered hantavirus. And in the United States, parts of the country, particularly the western part of the country, we do see about a dozen to 20 cases per year. Notably, in the last year or so, the wife of the actor, Gene Hackman, died of hantavirus in New Mexico. And there are cases that occur every year in those areas. The thing about hantavirus is that it's so deadly, the pulmonary form, because what it does is it damages the blood vessels around the lungs, causing them to become leaky, causing them to fill with fluid. There's no specific treatment for hantavirus. It's not something that you can take an antiviral for. And there's no vaccine for hantavirus. And that makes it a very dangerous disease because it has a high mortality rate. And it's often recognized late because the early symptoms are going to overlap with influenza. The thing that's really important about hantavirus, and one that's important to keep in mind when you see sensationalistic headlines, which you're going to see from time to time when hantavirus outbreaks occur, is that it doesn't transmit between humans. It is a rodent to human mechanism. Humans don't pass it on. So this isn't something that is contagious between humans. I'm going to get to one exception in a second. So when you see an outbreak, the key thing is removing the source of infection, the rodent issue, or when people are dealing with rodents, that they wear appropriate personal protective equipment, which would include a mask. This is an area where a mask would definitely help inhaling those aerosolized particles. So I said there's an exception. There is one hantavirus called the Andes virus that might have the ability to have limited transmission between person to person. It's not the main hantavirus, and it's unclear how contagious it is, but it's not on the order of any kind of respiratory virus, I would say. But that's not going to stop people from speculating about what might happen when there's a hantavirus outbreak because people don't contextualize that issue. The other thing about hantaviruses is that they go back in history. There's a really, really great book that I read. I'm just going to hold it up here. It's called Of Men, Mice, and Microbes. It came out quite a while ago, but it's probably one of the most comprehensive books I've read on hantavirus, and it is accessible to non-medical audiences. And it's interesting because we had this outbreak in the 1990s in the Four Corners region, but going back looking at some of the data that individuals in the Navajo tribe had accumulated, they knew of hantavirus. They describe it in their oral tradition. And they often said it followed bountiful years. Why might that be? It's a disease of mice. A bountiful year of chestnuts and nuts and things that mice like to eat increases mice populations, which then increases the rate of human exposure. An El Nino year, for example, where there's lots and plentiful rainfall, allows trees to flourish. They make nuts. The rodents eat those nuts, their population increases, and now a human is more likely to come in contact with them. So there is some cyclicity to hantavirus outbreaks in some parts of the United States. There's a lot of speculation about hantavirus, particularly the kinds that affect your kidneys and their role in hypertension or high blood pressure. And there are forms of it in Scandinavia, for example, that may be linked with hypertension at a higher degree. So we sort of separate the pulmonary viruses, the ones that affect your lungs, we call them New World hantaviruses, and the ones that are occurring in Europe, Old World hantaviruses, the ones that have kidney manifestations and sometimes hemorrhagic manifestations. But I think we still quite don't understand all there is to know about the viral ecology and epidemiology of the different hantaviruses. Now, I want to talk a little bit about this cruise ship outbreak that made the headlines. So what we know about this cruise ship is that there was a cluster of individuals that were infected with hantavirus, likely some of whom have died, some had to be evacuated to hospitals in South Africa. Now, that cruise ship's itinerary is going to be really important because the cruise ship reportedly left from Ushuaia in Argentina, a place I've been, at the very tip of the world almost. And Argentina is endemic for many hantaviruses. So the key question that epidemiologists are going to need to answer, or the one that needs to be answered, where did they contract it from? Were they on an excursion on the mainland of Argentina and those guests got infected and then the virus incubated and they became ill on the ship? Or are there rodents on the ship that serve as the source? That's the key question that needs to be answered. And that's going to determine the trajectory of the outbreak. Because if it was a source on the mainland of Argentina, for example, that exposure is over. If it's on the ship, that means more people could be infected if they're exposed to it. So then you'd have to get those people off the ship or remove the rodents. I think it's probably easier to get the people off the ship than it would be to remove the rodents. There will probably be issues with this cruise ship in terms of, can it dock? We know it's docked off it had to dock off the islands of the Cape Verde Islands. Will it be allowed to disembark the passengers there? How will they evacuate passengers? Those are all important questions to ask. And I think that this isn't something that is completely unprecedented. We know that rats and rodents can stow away on ships and can transmit diseases. But there will be a lot of panic because a cruise ship garners headlines, especially one that's not allowed to disembark its passengers and one that has a virus that's not known to be a cruise ship virus and one that can be deadly, and there have been deaths. So this will be something that will dominate the infectious disease news cycle for a little bit of time until we figure this out.